HMPV is an old entity. It's a minor virus. We have known about it for 60 years. It will not become a pandemic. India has nothing to worry about. China has nothing to worry about. The world has nothing to worry about. We have known about it for a long time. But since you won't get it and I won't get it, that chain of transmission will forever be broken.
Are you saying all adults are naturally insulated and we have nothing to worry? Only children and the elderly and the immunocompromised have things to worry?
I have seen a lot of cases of human metapneumovirus myself in older people. All of them have gotten better. I think India already has about 135 crore cases. If there are 10 people around you are coughing or have a viral illness, zero point 0.6 out of them have human metapneumovirus in India as we speak.
India has confirmed 7 cases of human metapneumovirus, that is the HMPV, with 2 cases each reported in Karnataka and Tamil Nadu, and 1 case in Gujarat and 2 children. That is as of now, as of today. Now, these 2 children also, there are actually 2 children who also tested positive in Nagpur, increasing the total number of cases of the respiratory illness to 7. So the numbers are rising at the moment. The government and the health experts have assured that there is no reason to panic, emphasizing that HMPV is not a new pathogen. They state that the regular flu vaccines and 3 doses of COVID-19 vaccine is enough to provide immunity. But we are going to get clarity on all these matters with regards to the HMPV. What are the risks and what are the remedies? How vulnerable are we at this point? Please join me in welcoming Dr. Ravi Godse, who's joining me from Pittsburgh in Pennsylvania in the United States. Thank you, Dr. Godse, for joining us. Before we start our conversation, I want to tell our viewers that Dr. Godse is a physician and a researcher who has made significant contributions to the field of medicine. He's a well-known author and a speaker as well, and he's written extensively on topics of health, wellness, and spirituality. Welcome, Dr. Ravi Godse, your understanding of the situation as we stand today, because to me, this sounds strikingly similar to how things began with COVID. The same outbreak in China, the same sort of symptoms, and the same way that the numbers are rising. What is your understanding of the HMPV virus?
Let me start off by saying something straightforward.
Yeah.
HMPV is an old entity.
Mm-hmm.
It's a minor virus. We have known about it for 60 years.
Mm-hmm.
It will not become a pandemic.
Okay.
India has nothing to worry about.
Okay.
China has nothing to worry about. The world has nothing to worry about. We
Okay.
have known about it for a long time.
Mm-hmm.
And I'll quickly say why it will not become a pandemic. First is, when COVID came, it was called as the novel coronavirus.
Yeah.
HMPV is a known entity. Some people think it was circulating for 300 years. Some people say 60 years. But we identified it confidently in 2001. And after we identified it, we have done retrospective analysis of our saved viral samples going years back. So we know about it.
Mm-hmm.
It only affects the people at the extremes of ages. Age less than 1, very high age, or immunosuppressed people. In fact, our CDC says that by the time you reach the age of 5, all of you would have had one episode of human metapneumovirus.
Okay.
So, second thing is, because it is a known entity, there is a worldwide herd immunity already available. Now, interestingly, the immunity against human metapneumovirus wanes. So, if you have had human metapneumovirus this year, you can get it again the next year, but you will not get seriously ill. So, the adults are already protected against the serious illness. Adults are actually already protected. We don't think there will be too much asymptomatic transmission. So, suppose a 1-year-old kid gets it in Afrida's house and a 1-year-old kid in Ravi Godse's house. For those two 1-year-olds to meet, they can only meet through you and me. So, the kid in your house can give it to you, you can give it to me, I can give it to the kid in my house. But since you won't get it and I won't get it, that chain of transmission will forever be broken. So that's why it
Okay.
will not become a pandemic. And the world
Are you
already,
saying all adults, let me get this clear. Are you saying all adults are naturally insulated and we have nothing to worry? Only children and the elderly and the immunocompromised have things to worry? Is that very clear?
means when you even say elderly, I
Hmm.
think we use this term very loosely. Means
Loosely, yeah.
Alexander the Great conquered the world at age 28, but that time the life expectancy was 32. So means he was kind of old guy when he did it. So now
Correct.
our US presidents are reaching 80s, right? So
Yeah.
we can't say more than 65 and all that. I have seen a lot of cases of human metapneumovirus myself in older people. All of them have gotten better, and they were all around 70s and they got completely better. Only
Oh.
problem they ran into was their insurance company didn't pay for their hospital stay, saying that that was not severe enough. So all of us are protected against serious disease. But we can still get a mild disease. In older adults, we will not even know it that we had the disease. So this chain
Okay.
of transmission will forever be broken. So it
Okay.
cannot become a pandemic. And also we have an existing level of immunity against this one. And I was little taken aback when you said now India has found 7 cases.
Yeah.
So I will tell you, I think India already has about 135 crore cases. The human metapneumovirus, I don't know. I don't know how to
So,
make this.
so
I think
this,
you
okay.
go ahead,
No, no,
please.
when we say numbers are rising and all, you're saying it can be misleading. That's what I understand because you're saying that there must be already existing so many cases. So the fact about numbers rising would be about what are you reporting and from where and to what extent.
No, and the
Huh,
thing is, there is something I said, like, where did this virus come from?
huh.
So I was saying that there's a two-month old child in Bengaluru, and they're looking at his travel history. I'm saying the kid was not in this world 2 months ago.
Yeah,
So the
I
kid
heard
just
that as
got
well.
so the kid just got here, and
Yeah, yeah.
to say that whether the kid has traveled to China, we don't have to travel to China. I can tell you, and I would politely say that I'm right. Okay, no
Okay.
question of being wrong. You can take it to the bank. No pandemic, nothing to worry about. So if there are 10 people around you are coughing or have a viral illness, zero point 0.6 out of them have human metapneumovirus in India as we speak. If there are
Okay.
100 people coughing around you, 6 of them guaranteed you can do their viral panels, I'll pay for it. And 6 out of 100 will be human metapneumovirus. So you are finding cases, we are looking for them. If you stop looking, you will stop
Okay, that's
finding.
a very good point. You're
Yeah.
finding cases where you're looking for them. So many of these cases, the detection itself, from what I understand from you, will not happen because it's not taken that seriously or reported to the authorities for the numbers to register. And the point is that it's very fashionable to kind of start looking at China and say, "Hey, look again, they've done it again." The outbreak starts there and they're hushing up, they're not disclosing everything, and this is what they did with COVID. So can you help us dispel some of that as well, because the idea is of course to bring clarity and to assure our viewers that much of what they hear around is also done to grab eyeballs and create a bit of a narrative around this thing because it gets us audience. But we don't want to do that. We just want to bring clarity that this China factor, and in India, like I said, it's very fashionable to say that they are responsible for this. How wary should we be about this outbreak, and that they are suppressing facts?
Means if China is suppressing fact, I mean, there's nothing to report. We know that. And what is truth? In a way, I mean, we can also look at the nature of the truth. But this thing, China and like blaming me, it should be between the virus and the rest of the human race. But unfortunately, but it's not new. It has been going on for a long time. In 1498, Columbus sailed the ocean blue, and suddenly a new disease cropped up in Europe.
Yeah.
It was called as the British fever by the French, the French disease by the British, Spanish, and it was syphilis, and they were calling by each other's name. I
Yeah.
shouldn't say it from United States. The last biggest pandemic that we saw, not COVID, the one prior to that, the Spanish flu of 1918 that killed 7 crore people. Some people think it could have started in United States. It's called the Spanish flu
Yeah.
because we have more money and more guns. Okay. So it goes along the national lines. So
Hmm.
obviously, but now what I'm thinking is just think about a Chinese mother who's worried about her 1 year old kid. And then there's no difference between a Chinese mother and an Indian mother. That's just a mother. And the
Yeah.
way we look at it, then the India's policy of Vasudhaiva Kutumbakam
Yeah.
becomes really
World
important.
is a family.
So
Yeah.
yeah, so the thing is they're obviously hiding things, and thing is their way of government. So we cannot really. So all the experts come and say we can't trust China to give us the data. Yeah, sure. I mean, what is there to talk about? But there are ways of getting the data now ourselves. In AI, we cannot depend upon them. What New York Times did was they went to the metadata of Weibo just now, the biggest search engine, and they found out what Chinese people are typing. What is the number one question that is being typed?
So
And
there is only so much that China can suppress. Is that what you're saying?
absolutely right. Yeah. So we are going to know. And because of the social media,
Yeah.
bad things cannot be hidden and good things cannot be made to work. Say human metapneumovirus, say we discover a vaccine and I mass vaccinate Delhi, mass vaccinate. And there are 10 bicycle accidents in Delhi every day. The
Yeah.
story circulating on WhatsApp would be I took the vaccine yesterday, I fell off my bicycle today, and that will kill the vaccine. I guarantee you. With this is the new age. That's the
Which is
reality.
why we have to be very careful when we set narratives, and those very eye catching and attention grabbing headlines or thumbnails now are actually the new thing that we want, the clickbaits. They would put such things, unfortunately, and that, I agree, does a lot of damage, because those fake narratives that spread, again, some deliberately as well, because some vested interests are there. Let's face it, there is money to be made from vaccines, etc. So there are both sides to it, isn't it? There is also a sense of mistrust with the vaccine makers, or the amount of money that is to be made. There is a suspicion around that as well.
Look, all the all the people who are saying things on social media should be taken seriously. They deserve an audience. So
Okay.
it's not that experts are always right. We saw it in COVID. In fact, I was like terrified that you will call me a COVID expert because no,
No,
I always careful to say I'm not an expert because I'm generally right. So I was terrified you might say that. But
no,
it doesn't
that's
mean
great.
the
Yeah.
experts are not right, but it doesn't mean that the more inexpert you are, the more right you are. That means it cuts both ways when such things are. And means of course there are conspiracy theories. There could be a conspiracy theory that metapneumovirus is cooked up by Apple to give bad name to Facebook because Facebook is now called Meta. But
Yeah.
yeah,
I never thought of that. That's
right.
interesting.
So it could be. But the thing
Okay.
is, obviously, say like you're a vaccine maker, and there's nothing wrong with profits, I would say. Obviously, you don't want to sell a product that is causing a lot of side effects. But two ways to go for that is penicillin was discovered in 1922. Can you imagine our life without penicillin now or without antibiotics?
Yeah.
Look at the yeah. So it was discovered in 1922. In 1944, there were 12 doses left because there was no money. US Army, British Empire was bankrupt. US Army had no money. The penicillin makers went to the US Pharma, and US Pharma said, hey, we can sell this stuff. And there were 6 billion doses in 3 months. So in capitalistic countries, there's a gumption to go out. And I'm not defending big pharma. They are like bad people. But when you run 100 vaccines, 1,000 vaccines, one of them is going to work. So the research and development cost of the other 99 or other 999 has to be recouped on that one. I mean, there have to be some incentive for them to stay in the business. If they have to
Correct.
make it for free, give it for free, and be
No, no, I
responsible,
didn't mean that, but I'm saying for everything, there's the other side of the story as well.
of
What I was
course,
trying to say
of
is
course.
sometimes some narratives are deliberately floated by those who are set to gain from from it. So, and when there is very big money involved, entire population involved, obviously some amount of profiteering agenda one cannot rule out. Let's face it. I want to play out, Dr. Godse, how the authorities are responding. There was one press conference just held today, and I will take the liberty to ask you whether the governments are setting the perspective right when they say this. So let's listen into the
Sure.
health
today
minister
because
of
of the importance
Maharashtra and
of
other
these
members
issues
of the
so
health
that people
ministry.
should know.
Okay.
All the entire
No, he is
cabinet
not the health minister. Please
मंत्रिमंडळाने
correct us
याची
here.
माहिती
Sure.
दिली आहे. At the department level, as honorable ministers have told, we are all ready. We have taken meeting. We are also in touch with the international organizations like UNICEF, etc. So we are all on board. कुठल्याही गाईडलाईन्स अजून केंद्राची कोरोनाच्या वेळेस केंद्र शासनाकडनं
Okay, let's
एक्सपर्ट्सनी
in fact
पाहून
now,
गाईडलाईन्स निर्गमित
because I would not be able to
त्या
translate in
गाईडलाईन्सच्या
Marathi. Let's hear
पेशेंट
Mr. Hassan Mushrif, who
जरूरत नहीं है ऐसा मैंने कहा है अभी प्रेस कॉन्फ्रेंस में। ये फ्लू जैसा वायरस है। 5 पेशेंट थे अपने देश में, उसमें से एक अच्छा होकर डिस्चार्ज हुआ है। उसे कोई डरने की जरूरत नहीं है। लोगों को सिर्फ 5 से 10 साल के जो बच्चे हैं जिनको सर्दी जुकाम है उनको सतर्कता बरतनी चाहिए। 65 साल के जो बूढ़े हैं, जो ज्येष्ठ नागरिक हैं कि जिन्हें कोमॉर्बिडिटी है उनको थोड़ी सतर्कता बरतने की जरूरत है। कोई चिंता करने की जरूरत नहीं है।
we also have
It was
the
first
Union Health
identified in
Ministry.
2001 and it has been circulating in the entire world many years, since many years. HMPV spreads through the air by way of respiration. This can affect persons of all age groups. The virus spreads more during the winter and the early spring months. On recent reports, the cases of HMPV in China, the Health Ministry, the Indian Council for Medical Research, and the National Center for Disease Control are keeping a close watch on the situation in China as well as in the neighboring countries. WHO has taken cognizance of the situation and will share their report shortly with us. The country data for respiratory viruses available with Indian Council for Medical Research, ICMR, and the Integrated Disease Surveillance Program has also been reviewed and no surge in any of the common respiratory viral pathogens is observed in India. Joint Monitoring Group meeting was held under the chairmanship of Director General for Health Services on 4th of January 2025 to review the situation. The health systems and surveillance networks of the country remain vigilant, ensuring the country is ready to respond promptly to any emerging health challenges. There is no reason to worry.
Okay, so Dr. Godse, I'll again want you to reiterate a little bit of what you said, that there is no chance of this becoming a pandemic. So, what is the worry really? The worry is the medical systems get overwhelmed. You know what we saw during COVID. So that is something that we do not want to arrive at, that sort of a situation. You know, so from what the ministers just said and from what you told us earlier, do you see us not getting into that situation at all, because this is not the same thing? Am I getting you correctly?
Absolutely. Means I think they shouldn't even be talking about it. There was an iconic line in BBC's hit TV serial Yes, Prime Minister. And it says, politicians like activity because that is their substitute for achievement. All this activity is meaningless. Means it is beyond meaningless. I think what they should do is, there's a French term for it known as laissez-faire. They should just let it be. Why are they getting involved? I get terrified when these people have a meeting and they start discussing things. So human metapneumovirus, as we said, is mild. They keep saying more than 65. There's no such thing. Nobody's going to get it. Only kids under the age of 1 year should be at risk, out of which most of kids won't get it. If they get it, in 85% people, it will just stay in the nose. Only in 5 to 14% cases, it can go into the lungs. Even then,
5 to 14. Okay.
yeah, 98% of the kids of those will get better at home. Some kids who have other immune issues, or some kids, even healthy kids, if they get ill,
Yeah.
they can reach the hospital. They could even be get pneumonia. They could even end up on a ventilator. New York Times says flatly that in rich countries, there should be no death from human metapneumovirus, even if the kid ends up on the ventilator. Now, I'll answer you. So, I'll answer your question as to if that is the case, why do we see images of the Chinese kids being in the hospital? Why are we seeing that? And once we know the answer to that, we will know what India should do. And the answer is nothing. Because of Chin's zero COVID policy, the strict zero COVID policy, the kids who were born on and after March 2020, for first 3 years of their life, were at home, not meeting other kids, not going to preschool, not interacting. So they were robbed of this God given opportunity to learn about these viruses and bacteria and develop their immunity. They have no natural immunity. And that's why we are seeing these cases. That effect will go away till 2027. India didn't have that. So our kids are already immune. So we are talking about a virus that is mild, which has always been there, doesn't cause serious illness. And now we start meeting about it, talking about it. Then some genius will come up with an idea of, oh, maybe let's just do travel monitoring, or let's do travel ban. Other countries will retaliate. And the situation escalates into like what a storm in a teacup. It just generally becomes.
You're also saying none of these precautions, which we were taught how to wash our hands and all of that, none of that is also necessary.
I'll come to that in a second.
Yeah.
Okay. We are saying why China in trouble now? Because their kids have no immunity. Why do they not have immunity? Because they were stuck at home, because they were taking precautions. So too much precautions led to this. So we understand that. And what is our next step? Each and every person worth his salt is going on TV and saying, exhorting people to take precautions. Taking precautions is such mindless thing to say. What the heck does it even mean? Take precautions. I was on another show and they're telling people to avoid crowded places. If you want to avoid crowded places, immigrate to Norway or Finland or Greenland. You can't
Certainly
live.
not in India. Every place is
Right.
crowded.
So you
Think
live
about
in
Mumbai.
you live in Mumbai, and a guy
Yeah.
who makes his living selling vada pav, and you are telling him to avoid crowded places. Means there has to be some connection between what we think and what we say, right? So that is one thing that is meaningless. Second thing is masks. So I'm a healthcare provider. So obviously I'm not against masks. Okay. But I'll say this: original COVID and Omicron. Omicron was 300 times more infectious than original COVID. And we were not able to stop the original COVID with the mask. And we tried that in Omicron, fining people 500 rupees for not wearing mask. Indian people should fine the government that they
Now,
wore masks and they had the Omicron. So government should pay them five. Means that's the definition of insanity. That doing the same thing again and expecting a different result.
Dr. Godse, you do realize that if what you're saying with so much certainty doesn't turn out to be true, and say 3 months, 2 months down the line, we'll see a COVID-like situation, I'm going to have you on the show again to tell us what made you so sure at that point of time.
First of all, when India's first wave came, I predicted there will be no second wave. And that was the only prediction I got wrong. And that was based on, I thought, how many vaccinations will be done by then. Delta was a totally different animal. I was actually the only person who had said with confidence in May that there will be no third wave. And I have been right since. So wearing too much masks, first of all, it doesn't stop a highly infectious virus. If it is airborne, it doesn't stop. Okay. So
Not
you are,
even with an N95 mask.
I'll N95 mask. I don't know whether you're not a healthcare provider. So if you're not wore a N95 mask for a
I
long
have.
time,
Uh,
it's very uncomfortable, as you
it
know.
is. It is.
And another thing is, I'll tell you the mindlessly idiotic thing about it. Okay. And I'm speaking like a layperson now, not as a
Hmm.
physician. We had a big conference during COVID,
Hmm.
all the doctors, head of ICMR, and all that. So we were having a meeting beforehand. We had what we call in India chai and biscuit.
Hmm.
And then we went on TV. And then all the Indian doctors put their N95 on. So I said, we were sitting cheek to cheek drinking tea. So if we were to exchange COVID, we are already exchanged. Now, why this nautanki when the cameras are on to wear the mask? So you go to a place of work, you work there for 9 hours. So you wear it a N95 mask, robbing you of the just freedom to breathe. And during lunch break, you take it off for half an hour with all your colleagues. So are you telling the virus don't impact us during we have a strategic timeout? No. So
Yeah.
it doesn't work. And another thing is, remember, they were fining people for carrying plastic bags.
Hmm.
Now a surgical mask, cloth masks are used in India. US only uses the surgical mask. A surgical mask takes 400 years to get destroyed. Billions of masks that are created and that are going to take 400 times billion years to destroy. Does it not add to the environmental pressure? Means on one hand, we are crying about the green earth and all that. So we just don't think this through. So washing hands, I'm okay with that. I have no problem with that. Wash your hands, but otherwise don't take any precautions. I'm saying taking precautions is wrong. Worrying about things is wrong. And you need to live a little, right? Means this is human metapneumovirus, which is very similar to RSV. There is Marburg, H5N1 is coming, avian influenza, there is Ebola, COVID has not gone away. There are newer.
A lot of it is, of course, the media glare, and the moment you have like two, three, five people talking about it, it just automatically picks up momentum, and then everybody wants to talk about it. But like I said, my idea is only to clear the air, and I'm glad you've done much of that today. I want to ask you a couple of concluding questions. First, of course, about whether winters is the period of time where generally we are more vulnerable to many of these viruses, because so many reports I see now is talking about it's a winter thing. And therefore attributes this virus as well to the winters.
Interestingly, there is one country that doesn't have any winter. That's
Hmm.
Singapore. It's
Hmm.
equatorial. And Singapore had equally strict lockdown as China.
Hmm.
So we might see some cases in Singapore suddenly.
Hmm.
On June 22nd,
Hmm.
the same day Napoleon invaded Russia, we are going to
Hmm.
start seeing cases in New Zealand.
Hmm.
Write it down, guaranteed, because that is will be the height of their winter, and they also had a strict lockdown, though that effect should be. So in northern hemisphere, we see this late winter, early spring, and we monitor the data weekly. In 2024, on 28th December, of our respiratory illnesses, 19.1% were flu, 7.1 were COVID in United States, and 1.91 was human metapneumo. In 2023, immediately after COVID, it was 10.1. So 10 out, 1 out of every 10. So it generally happens in winter, and now we are monitoring it. Now, having said that everything is okay, there's just one thing, two things that are puzzling me a little bit. I want to
Hmm.
be on the record,
Yeah.
that
Okay.
after COVID restrictions ended in UK and USA, we suddenly saw some cases in England in June, and we never do, never, ever.
Hmm.
And they reported it. And a Netherlands hospital reported that they saw some cases too. And then it mysteriously disappeared. That has intrigued me to no end. Why would that happen? And second thing, I'm not worried. I'm not at all worried. You can take it to the bank. There is no pandemic. I'm saying that 1 week later, there's not going to be a news. This is just going to blow away.
Okay. Hmm.
But people, the cases in China are up to age 14. That is puzzling because when the pandemic started, the kids who were 9 years old would have had 9 chances to get acquainted to human metapneumovirus. So why are those 9 years old? Means why 14 is not really adult, neither it is child, it is on the threshold. So why up to 14? And the question that we are talking about, that is most research on Weibo, they are not asking does the flu hurt? They are asking why does the flu hurt so much? That is the top trending question in China right now.
Okay.
So we know flu hurts, it causes little muscle pain, but it doesn't hurt so much that millions of people will go to Google or their equivalent of Google. So uh, means it's a little different. So
Right.
now people
So
are
you
saying,
do. So you do agree, or you do say that no, we don't have all the answers yet.
of course we don't
Right?
have the answers.
We don't have all
So
the
if we are
answers yet.
talking about human metapneumovirus, we have nothing to worry about.
Okay.
So if it is spreading that wildly in China, which has no immunity, while it is spreading, while it is replicating, can it mutate like what happened from ancestral strain of COVID to Delta? It is possible because it is a single-stranded RNA virus compared to a
Let me
double.
ask you a final question then,
Yes.
to sum up everything that we discussed. Uh, is there a worst case scenario that you envisage? What would that be?
Worst case scenario that the market will react to it, people will lose money and they'll lose happiness for 1 week. That's the worst case scenario. Nothing else is going to happen.
All right. Thank you, Dr. Ravi Godse. I'm out of time on this, but thank you so much for joining us, sharing your views, giving us all the clarity on this. It really helps to know, and of course, I've come out wiser after listening to you. Thanks very much.
Thank you. Thanks a lot.